Hello friends, today we are going to discuss a new chapter in new second sessional examination. So from this chapter we are discussing a second sessional syllabus, that is chapter number 14, centrally acting muscle relaxants and anti-Parkinson's drug. So centrally acting muscle relaxant means what? Centrally acting muscle relaxant, that is those drugs which having capacity to relax the muscle can effectively reduce the rigidity muscles without affecting the consciousness and normal voluntary movements. So when we are given the drugs like centrally acting muscle relaxants, these drugs are reduces the muscle rigidness are reduces, and while doing such activity the consciousness normal consciousness of patient is not disturbed. Patient is aware about the activity which are happening besides that person. Okay, so well-known example which can be used as a centrally acting muscle relaxant drugs, that is mefenicine, then methacarbamol and diazepam. So mechanism, see the mechanism of action of mefenicine. Site of action, the site of action of mefenicine on midbrain, then brainstem at the level of thalamus. It mechanism of action of mefenicine, that is it antagonizes the strychnine conversion. So in pharmacology and toxicology practical, the muscle relaxant activity due to strychnine is a CNS stimulant drug which stimulate the activity. So when strychnine secretion increases, that can causes the convulsions. So this drug is having property to reduce the rigidity. So antagonism, that is reduces the activity of strychnine. Due to that, convulsions are produces in the muscle are reduces. Then it has centrally sedative action. Centrally sedative, that is which is having capacity to produce the calmness as like diazepam. Also it can obtain a muscle relaxation in surgical anesthesia. So surgical anesthesia is the very much important stage we are discussing in the general anesthetic chapter. So in that stage the major surgical operations are carried out. So this drug is having another use in the surgical anesthesia. Surgical anesthesia, normal surgical operations can be carried out effectively by using this mefenicine drug. The adverse effect of mefenicine, that is it can produces the weakness. If we are taken a larger quantity of mefenicine, then it can produces the weakness in patient. Also double vision, that is another disadvantage, double vision. Then muscular incoordination, that is more relaxation can be produces. So that is not beneficial because muscle rigidness at certain extent it is well, but the more relaxation is also not beneficial while the normal behavioral activity. Then this is about the centrally acting muscle relaxant drug. Then next important part, that is the Parkinsonism and anti-Parkinson drug. So what is Parkinsonism or Parkinson's disease? So Parkinson's disease is a disorder of dopaminergic fibers. Parkinson's disease caused due to the imbalance of dopaminergic fibers, that is in our body the internal activity, that is the autonomic nervous system activity are happen. So that chemical secretion, then the information receiving, then another important activity as like blood circulation, then our immunity system, that all activities are performed without interfering the external criteria. Okay, so our autonomic nervous system is helpful for persisting regulating that all activity. So if in that activity there is a disturbance in the secretion of dopaminergic fibers, dopamine level get increases, then such activity or such disorders can be produces, like Parkinson's disorder. So Parkinson's is characterized by the muscular rigidity, tremors, and akinesia. So muscular rigidity, due to more muscular rigidness, akinesia and tremors are the symptoms of Parkinson's disease. So anti-Parkinson's agent, and anti-Parkinson's agent definition very simple: those drugs which are used in the treatment or relieving from the Parkinson's disease, such agents or drugs are called as anti-Parkinson's agent. These agents which increase the dopaminergic activity. Due to that, what happen, when dopaminergic activity get increases, the dopamine level in our body get maintained. Okay, due to that muscle rigidness reduces. Example, levodopa amantadine. Okay, then the another drug, another class, that is those reducing the cholinergic activity. Cholinergic activity like acetylcholine. So acetylcholine and dopamine level is 75% acetylcholine, which is required for the normal activity, and 25% dopamine, which is required for the normal activity in muscle activity. If that level get reduce increase, then Parkinson's disease like muscle rigidity, such activities can be produces. Okay, then last, that is these those used for the treating symptoms such as mood changes, mood aware antipsychotic drugs. Okay, such drugs can be used. So levodopa, the activity of levodopa, see, levodopa is a dopamine precursor. Dopamine precursor, due to that levodopa can crosses the blood brain barrier. Due to that, what happen, when any drug can crosses the blood brain barrier, then that drug activity get increases. Permeability is a very much important criteria when we are given any drug to any patient. If blood can crosses blood brain barrier, drug can crosses blood brain barrier, then that drug is beneficial in the normal activity. Used for symptomatic treatment of this disease. Symptomatic, that is according to the symptoms we are treating that uh, disease. And symptomatic relieving of person, uh, symptomatic relieving is persist in that particular person. Used in combination with anticholinergic drugs. Combination drug therapy is beneficial for treating anti-Parkinson's drugs. So levodopa is combined with carbidopa. Also antihistaminic agent. So antihistaminic agent, that is those agent which reduces the allergy in person. So levodopa is beneficial in the antihistaminic activity. The side effect of levodopa, that is bobbing of head and neck. That is, if we are given the adverse dose, then bobbing of head, that is more relaxation. Due to that, what happen, bobbing of head, movement of head get increases, that is bobbing of head and neck. Then atrial flutter, nausea and vomiting are the another adverse effect of levodopa. Then once important region can be asked in your sessional examination, also in annual examination, that is levodopa is always given in combination with carbidopa. So in previous point we are discussing that same point, we have to discuss, that is levodopa is a precursor of dopamine, precursor, that is similar, that similar as like that. Okay, so levodopa can crosses the blood brain barrier, but dopamine cannot cross it. Dopamine is not having ability to cross the blood brain barrier. So when given in combination with levodopa, then dopamine can cross blood brain barrier along with the levodopa. Leu- the enzyme dopa decarboxylase is also present in the blood plasma, which convert absorbed levodopa to dopamine. So another important point, that is they are saying enzyme dopa decarboxylase is present in blood, but due to the absence of levodopa, that conversion is not takes place. So levodopa is beneficial for conversion of dopamine or beneficial for crossing the blood brain barrier. Carbidopa inhibit this enzyme. Carbidopa can inhibit this enzyme. So that levodopa is always given in combination with carbidopa. Okay. So this is about the centrally acting muscle relaxants. Very simple and small chapter we are discussing. If any student is having problem, then you can ask me.